Super to be here. Great to have such a diverse audience and to interact with you on the chat and have questions. So my name is Marc Beswick, an occupational therapist, previously using Near Me pre-COVID clinically on a remote island called Shetland off the Scottish coast, halfway to Norway. And since then, I've been working on supporting services right across Scotland to offer Near Me as a choice and an option for people interacting with services, not just in health, but across the whole of health and social care. So what I'm going to concentrate on very much is, I just need to move this there, is an introduction to Near Me, just as a general kind of scene setting across Scotland. And then we're going to do a bit of an explore about what that means in primary care. So we're going to explore what we've done with practice administration teams and supporting them using Near Me as a choice. And also we've done some work with GP practices across Scotland, looked at the ones that have used it well and learned from them and shared some of that. So let's just see if I can move on a page. Okay, so basically, Near Me, I'm going to ask Ulrich to put a link in the chat to our main website. So it's a video consultation service that's available freely across Scotland to all public health services. It's enabled in all primary care settings, both from a software and a hardware perspective. It's safe, secure, and free. It's designed for healthcare use, and patients access it by a web link. So there's no login, there is no software to download, there's no identification to create. And you can also invite colleagues, a carer, or you can invite an interpreter into your video call to support that patient's interactions with you. It also has a feature where you can rapidly move out to a video consultation quickly if you're in an urgent care setting. And also we have a group function now. We're up to 60 people and soon to be over 200 people can join a group call, again, in this very safe, secure and freely available platform for people in Scotland. Within the group setting, you have chat, breakout rooms, you can share screens, videos, presentations. So all the kind of things you'd expect to see what we're doing in Zoom, but it's like super secure just for the health service. So that's kind of, what Near Me is as a tool for us to use in Scotland. Our current data that we've got, so this is from last year's survey data from our platform. So again, you can see we've got lots of active users, we've got many organizations, loads of people coming to groups and looking at it's nearly 2 million consultations that have been undertaken now. And that's saved over 64 million miles of travel across the whole of Scotland. So again, a big environmental impact as well as convenience for patients. This is the information we get back from patients. So 25,000 people have filled in a post Near Me call survey. And you can see here the advantages around saving time, money, better for the environment, and also not having to take time off work. People really value the convenience and how it works for them in their lives, the offer of having a video consultation rather than traveling to an in-person appointment. And as you can see, once we've offered a video call to somebody, people have generally, well, over 90% of people are quite happy with their experience, and nearly 97% of people would happily have one again. So getting across that first video consultation, you're likely to be able to have another one. Excuse me. So that gives you a general flavour as to where we're at with Near Me across the whole of Scotland. So how does that look like in primary care? So we did a bit of work in primary care, and what we found out was that our reception teams, our front of house teams, were absolutely key to making Near Me a choice when we contact primary care for help. So we co-created some guidance for these front of house staff. We co-created it with general practitioners, with practice managers, and with the administration staff as well. And this was followed on from a webinar we did with high-use GP surgeries across Scotland. And what I'm going to do, I'm going to ask Ulrich, we have this guide is available freely on our website. So again, you can have a look at that and I'll show you bits and pieces of it in the next few slides. This is just a snapshot of one of the flow charts we created with the admin teams. And again, we created resources that reception staff could have on their screen, or they could print off and have next to them on their reception desks, just so that they could refer to it when having conversations with people phoning in for appointments. What we also did was some practices actually gave receptionists a list of things that they felt lent themselves to video consultation or phone or in person. And again, these are very much local to that particular practice. It's a general indication, what could be managed by different consultation methods, and it could support people in local decision making. But again, they need to be reviewed for suitability and safety locally, and also be aware of red flags that might indicate something like a child protection issue or an adult protection issue or abuse. So again, very much a rule of thumb rather than a hard system to follow, but it just gave people a little bit more guidance. So then we thought we'd have a bit of a deep dive into what GPs are using Near Me well across Scotland. So we found the top 10 practices that were using Near Me in Scotland. We did a real deep dive into 3, and they were classed as remote, rural, or urban small towns. So again, small, medium-sized practices. They weren't massive practices, but they were indicative of many practices across Scotland. So these practices told us that up to 30% of their patient consultations were by Near Me. So the rest were either telephone or in person. You can see that the appointments were scheduled and they had the infrastructure ready within the practice, both the reception teams and the practitioners. And so we talked about a blended model earlier, about that hybrid model. So again, this is what's come out of what we found from these practices. And the real key part of the reception team is absolutely key to this, for setting this up, for maybe doing a test call, for getting the patients ready. And these practices also were very upfront with their communications with the public. The public were expecting to have choice and option around phone, video, or in person. They were expecting to maybe not see the GP. It could be the physiotherapist, could be a pharmacist, could be signposted to somebody else. So that preparation for people contacting the practice. And these practices told us the most value was gained in these areas here. So in terms of mental health, having sight of someone's surroundings at home can tell you a lot about your decision-making around that person's mental well-being. Having carers involved, whether that's at home or in a care setting, was really valuable. And on a Near Me call, you can bring that person in. Managing long-term conditions like diabetes was really valuable. When you've got multiple professionals and people having multiple appointments, you can do all that remotely for those people. Pharmacists were using it for medication reviews. Occupational health review assessments were really popular as well for doing that with patients. And children were just more like themselves at home rather than the clinic. So being able to look at a pediatric patient at home often gave you a more realistic information about decision making. Elderly complex patients in care homes were really lots of value gained from involving carers, involving staff, and involving important people to that person in the elderly complex area. And again, doing some neuroscience presentations have been really helped by actually seeing that patient rather than relying on the phone. So that gives a snapshot of some of the things that we found in Scotland from our high users. And again, what's next? So we found that we can increase capacity and flexible working for these practices. We've got staff not actually based in the practice. They could be anywhere in Scotland offering services. We're looking at consultations between primary care and secondary care, bridging that gap sometimes that occurs between those two services. And that choice and convenience for patients, that's been really valued by the patients that have chosen this. I'm not having to take time off work or find childcare, those kinds of things. And also when trying to contact patients, if you're phoning out and they're not in, they're actually waiting ready for you in the virtual waiting area that Near Me has. And this has been intimated before, that the practices that are using it well, just use it more. People get used to it, the staff get used to it, the patients want it, and it just cycles up once it's embedded. So I suppose I'd ask you as a group of participants today, what's the perfect blend for you of telephone, video, in person, or asynchronous? And that's a journey you'll go on with your staff and the patients accessing your services. But I think, what is that blend? What's going to work for you? This is a pile of links to our resources across Scotland, which are freely available. And what I'll do, I'll ask Ulrich to plant these into the chat and the Q&A as well, so folk can have a look at those. And there's also, you can also contact us as well via the website to any questions or ongoing conversations. I'm very happy to continue this on Twitter or LinkedIn or whatever other platforms people are happy to use. So that's all I want to share on that. Happy to take questions and discussion, and back over to Rebecca. Thank you very much.